everyone, welcome to IR5U. Today we are going to talk about tumor embolization. As I started before, interventional radiologists are also known as surgical radiologists. They are medical specialists who perform minimally invasive image-guided procedures that are used to diagnose and treat diseases in nearly every organ system of the body. Some of the procedures are life-saving. Interventional radiology means minimal access with a maximum result. In this session, I'm going to talk about a procedure called tumor embolization. Tumor means an abnormal growth of tissue, which could be cancerous or non-cancerous, while embolization means occluding a vessel to reduce or stop the blood flow into that vessel. Overview. This is a minimally invasive procedure in which a small thin tube is guided into the vessel which needs to be embolized. Embolization can be performed with different agents which may vary depending on the type and location of the blood vessel. Different types of agents that are used for embolization include particles, coils, or some of these are liquid based. Just for an example, a common condition most of people know, uterine fibroids. These respond well to embolization of the blood vessels which supply the fibroids, and what we do is we block off the blood supply to the fibroids. In contrast, an emergently bleeding vessel from a trauma sustained by a patient may respond well to embolization with coils. Sometimes we have to use a combination of agents to achieve our desired outcome. So the desired outcome, what is we are aiming for stopping of the blood flow or stasis of the blood flow. When it comes to the tumor embolization, the main aim is to cut off the blood supply to the tumor, which decreases the level of oxygen within the tumor. This in turn causes tissue necrosis or death of the tumor. Certain liver tumors respond best to embolization with small particles which are infused with chemotherapeutic agents. Other liver tumors, they respond well to embolization with the radioactive particles which kill the tumors with radiation. On some occasion, the embolization may also be performed to arrest potentially life-threatening bleeding because of the tumor. What are the main benefits and applications for tumor embolization? Embolization has a number of benefits such as relieving symptoms like heavy bleeding, decreasing the size of the tumors so that the surgeons can go back in and take the tumor out, reducing the loss of blood during surgery to remove a tumor, and not the least, slowing the tumor growth when surgery or chemotherapy are not possible. It can be applicable to various conditions like cancer tumors, in particular to the liver, you can say primary liver cancer, secondary liver cancer, which is spread to the liver from other sites of the body, non-cancerous tumors like uterine fibroids, tumors involving kidney like angiomyolipoma, tumors involving prostate gland. Pre-operatively, sometimes what the surgeons ask the interventional radiologist is to cut off the blood supply so that there is less blood loss during the procedure. How is this performed? So, tumor embolization or any other embolization are performed by using imaging such as ultrasound or a fluoroscopy. Fluoroscopy is an X-ray video. A small incision is made either in the groin or in the arm area to access the blood vessel. And through this blood vessel, carefully a catheter is threaded into the vessel. Contrast dye is injected through the catheter to visualize the blood vessel. The catheter is directed to the area to be treated, from where the embolization agents are deployed to seal off the blood vessels. When the embolization procedure is complete, the interventional radiologist removes the catheter and holds pressure or places a plug to stop bleeding. No stitches or large incisions are necessary for this procedure. Most of these treatments are performed with either an intent to cure, either to decrease the size of the tumor for future resection or for future transplant, or Sometimes this is done for comfort care. In liver tumor treatments by embolizations, there are three types. These are based on the liver function, the tumor spread, and the patient's clinical conditions. So the different types, the first one, we can talk about bland embolization. Bland embolization is where small particles are injected into the tumor blood vessel to stop the flow of blood to the tumor. The second one is a chemoembolization, where small particles are coated with chemotherapeutic drugs. These are injected into the vessels supplying the tumor to stop the flow of the blood to the tumor. The third one is radioembolization, where tiny beads are filled with radioactive isotope or injected to the vessels supplying tumor. This delivers a high dose of radiation to the tumor while sparing normal tissue. Which one of this is perfect is based on the decision by multidisciplinary team, usually consisting of an oncologist, an hepatologist, a surgeon, an interventional radiologist, and a radiation oncologist. This may vary depending on the type of condition you are being treated for. Information about each procedure will be provided during consultation, as well as details about the labs needed, the medications that might need to be stopped prior to the procedure. Some of the medications have to be stopped, especially the blood thinning medications. And other precautions pertaining to the procedure will be discussed during the consultation. These procedures are typically performed with conscious sedation and may typically take few hours to complete. Most of these procedures require one session, while some require at least 2 sessions. In this, during the first session, sometimes we do something called planning angiogram to assess the anatomy, and the treatment is reserved for the second session. Your doctor will explain if further sessions are needed. Patients should expect to remain in the hospital several hours post-procedure or sometimes overnight stay for monitoring. Patients undergoing embolization procedures often describe mild pain or fatigue for about a week. In most cases, normal activity can resume in 1 to 2 weeks. In chemoembolization, patients might experience post-embolization syndrome, which is a group of symptoms like fever, nausea, vomiting. It can happen with any procedure of embolization, and this can be managed by pain medications and antibiotics. The reason for this one is toxins are released by the dying cells. Rarely these symptoms require hospital admission for further management. Like any other procedure, these procedures all carry with them a few risks: bleeding, infection, injury to the blood vessel, or sometimes the particles might go to the area which are not intended to. They are accidentally released to normal vessels. Rarely, the bleedings secondary to the treatment could be significant, leading to further interventions, blood transfusions, ICU admission. Once the procedure has been performed, a follow-up imaging is usually performed 1 to 3 months after treatment, along with a subsequent clinic visit with your interventional radiologist to determine the results and allow for further treatment planning. Thank you.